Your doctor keeps adjusting your blood pressure meds, but your numbers are still high. You feel tired all day, wake with a dry mouth or headache, and your partner complains about your snoring. It's easy to blame stress or age. But there's another quiet troublemaker: sleep apnea. Today, we're talking about sleep apnea and high blood pressure, how they're connected, and the subtle signs often ignored. This is general education, not medical advice. It might help you ask better questions and catch a problem early. Sleep apnea is a condition where you stop breathing for short moments while you sleep. Your airway relaxes, air can't move, oxygen drops, and your brain panics. It jolts you awake to reopen the airway. You might snort, gasp, or roll over, then go back to sleep without remembering. This can happen dozens of times a night. Even if you're in bed for 8 hours, your sleep is broken. Your body never gets the deep, healing rest it needs. How sleep apnea pushes your blood pressure up. What does that have to do with high blood pressure? Every time you stop breathing, your oxygen level dips. Your brain sounds the alarm, your body releases stress hormones, and your heart rate and blood pressure spike. Night after night, your system lives in emergency mode. Over time, your blood pressure can stay high even during the day. Untreated sleep apnea is a hidden reason blood pressure is hard to control, even with multiple medications. If your blood pressure is stubborn, especially at night or early morning, sleep apnea might be a missing piece. Because it happens while you're sleeping, sleep apnea is easy to miss. Signs you might miss while you're asleep. Nighttime clues often brushed off include loud, regular snoring, especially with quiet pauses, then gasps or snorts. Gasping, choking, or snorting awake, or waking up suddenly feeling like you're fighting for air. Waking with a dry mouth or sore throat, restless sleep, or getting up to pee multiple times a night. You might not see this yourself. Often, a partner, roommate, or family member notices. Feedback like, "You stop breathing and then gasp," or "Your snoring is so loud I can't sleep," is a big red flag. Don't ignore it. Daytime signs that don't look like sleep problems. During the day, sleep apnea doesn't always look like a breathing problem. It looks like feeling exhausted even after a full night's sleep, or needing naps and nodding off in meetings or at red lights. Morning headaches, brain fog, trouble focusing, feeling low, anxious, or irritable, and waking up unrefreshed almost every day. Many blame this on age or stress. But if you have high blood pressure plus these symptoms, your sleep is worth a serious look. Why women often get missed. Sleep apnea is often pictured as an older, snoring man, but that's not the whole story. Women can have sleep apnea too and are more likely to be undiagnosed. Their snoring may be softer or dismissed. They may report insomnia, fatigue, mood changes, or headaches. Symptoms get blamed on menopause, anxiety, or hormones. If you're a woman with high blood pressure, low energy, and unrefreshing sleep, don't rule out sleep apnea. Who's at higher risk? Anyone can have sleep apnea. Your risk is higher if you have high blood pressure, especially if it's hard to control. You're overweight, carry more weight around your neck or belly, or have a larger neck or a crowded airway. You're middle-aged or older, snore loudly, drink a lot of alcohol, smoke, or have a family history of sleep apnea. These are risk factors, not guarantees. If you recognize yourself, take your symptoms seriously. When to talk to a doctor. What should you do if this sounds like you? Ask someone who's seen you sleep. Have you noticed me snoring loudly, choking, or stopping breathing in my sleep? Track your clues for a week. How you slept, any snoring/gasping, how you felt in the morning, and your blood pressure readings. Bring it to your doctor. Say, "My blood pressure is hard to control, I'm tired, and my partner says I stop breathing. Could this be sleep apnea?" They may recommend a sleep study at home or in a lab to see what's happening at night. The goal isn't to label you, but to protect your heart, brain, and long-term health. The hopeful part. The good news. If you treat sleep apnea, you're not just snoring less. You may sleep more deeply, feel more awake and clear-headed, ease the workload on your heart, and help manage your blood pressure. Small changes at night can create huge benefits during the day. You don't have to figure it all out alone. If this video made you think, That might be me. Don't ignore that nudge. Talk to a professional. Your future self will thank you. If this helped, hit like, subscribe, and share with someone who has high blood pressure, mystery fatigue, or snoring everyone jokes about. Sometimes that joke is actually a warning sign.